Hello everyone. Till now we have discussed about history taking mnemonics, specific, CVS, GI, OP-GYN. Now we are going to discuss about CNS, how to take the history. Generally, the symptoms will be headache. If you get a case of headache, you can ask for OCPUs, relation with menses, and photophobia, dizziness, loss of consciousness, seizures, weakness, numbness, tingling. If there is a case of weakness, you can go for asking difficulty performing overhead activities, getting up from seating position, and you can ask for the specific symptom of electric shock like sensation when you bend your head forwards. You can ask for that, and vision changes like blurry vision, diplopia can go for that. Difficulty in gait, speech, swallowing, vision, hearing, forgetfulness. These are all CNS symptoms. You can ask generally. You'll get one or the other DDs if you ask for all these. Specifically for headache, you can ask for location or apart from OFDP like array, you can ask for facial pain, temporal pain, jaw claudication. This will aid in the diagnosis of temporal arteritis, if I'm not wrong, and retroorbital pain, lacrimation, rhinorrhea. If they are associated with headache, you can go for the DD of cluster headache. So that will aid in the diagnosis. And in case of forgetfulness, you can ask for difficulty in daily life activities like bathing, dressing, cleaning, eating food. And also you can ask for difficulty in performing executive tasks like cooking, housework, shopping, managing finances, bank accounts, like that. And you can ask for whether he has a difficulty in remembering things like faces, names, ways, the way to go back to home. If he forgets, then dementia will be a diagnosis. Coming to dizziness, you can ask for austic symptoms of seizure. A means aura, AU, shaking movements, trauma to head. Have noticed any tongue bite, incontinence, postictal confusion. If all are positive, you can go for a diagnosis of seizure. And as for skipping of meals in case of dizziness, whether he has any skipped meals prior to the event. If they say yes, you can suspect hypoglycemia. And hearing loss, ask for that. Hearing loss associated with dizziness, meanness, like that you can tinnitus, like that you can ask ear pain or ear discharge, and feeling of imbalance, vertigo. You'll get to a diagnosis. In case of hearing loss, specifically, you can ask for trouble localizing sounds in case of acoustic neuroma. For presbycusis old age, you get the specific symptoms will be words, sound is jumbled, distorted, and they'll have a trouble understanding the meaning of the words or speech of the words, and there will be hearing loss for all the sounds or any specific sounds. You can ask like that. In case of Meniere's disease, tinnitus, vertigo, painfulness in ear, you can ask these symptoms. You'll get to a diagnosis. Specifically in pediatric patients, you can ask this, you can remember this mnemonic fever card seizures deals. And in case of general history taking, PAM FBH is for PAM is for past medical history, allergies, medications. F is for family history, BH birth history, IH immunization history, DH developmental history, and then diet. Along with these, you can ask for a stridor, hoarseness, neck stiffness, rigidity, sore throat, drooling, facial cyanosis, dyspnea, body swelling, chest retractions, postosuomisis. If you ask all these symptoms, you'll get to a diagnosis of severe resp or any specific diagnosis you'll get. And in case of this fever card seizure deals means F means fever, E means ear pulling, V means vomiting, again E means ear or eyes discharge, R means rash. One more in card, C means chest and cold symptoms. You can ask for chest pain, SOB, fast respirations, running nose, cough. U for urination, whether it's increased or decreased. You can ask for smell of urine, any change in color of urine. Demons, diarrhea, what is the frequency, onset, mucus association, any blood in stool. Does your baby cry during defecation? You can ask that. Seizures, stick you can ask. Deals, daycare, ill contact, eating habits, with the feeding, with the water intake, and appetite, look of the baby, and with her sleep. So thank you so much. Hope you enjoyed this video. Thank you.